Okay, this is the second round of EBA 2014 meetings that we've held. Can I just get an indication of who in the audience attended the first meeting around? Okay, a little less than half. It's fantastic that you've all brought at least 2 other people with you today, so congratulations. The next time we meet, if you could all bring 1 more, that would be fantastic. During that last round of workplace meetings, and through an online poll that we conducted, members have endorsed a claim of 9% over 2 years. That's 4% this year from the 1st of July and 5% from 1 July 2015, with no trade-offs, and in addition, action to enforce permanent employment. So that's a claim which we're making on the Department of Health. Those of you who are workplace representatives here at Sir Charles Gairdner Hospital may have attended the workplace reps meeting that we held on the 2nd of April. That meeting endorsed the claim and made a number of recommendations and resolutions that were subsequently put to our management committee. And I just want to read the 3 that are appropriate. Firstly, the workplace reps meeting on the 2nd of April resolved to approve and commend to the Committee of Management a pay claim of 4% from 1 July 2014 and 5% from 1 July 2015 with no changes to conditions of employment, and request the claim is served forthwith on the Department of Health. Secondly, the workplace reps called on myself as Union Secretary to organise mass meetings of members to determine what actions might be needed to achieve an acceptable offer by the 30th of June 2014, and your representatives resolved to build, support and encourage maximum attendance at the mass meetings. So congratulations to all the workplace representatives here at Sir Charles Gairdner Hospital on the turnout today. You've obviously taken your resolution to heart and ensured that we've had the best possible attendance that we could expect for today's meeting. The claim has been served formally on the Department of Health. Negotiating meetings have commenced. I think we've had 1 formal meeting, Chris, and no offer has yet been tabled. That's not unexpected at this point, but the meetings have commenced. And this is the first, or not the first, it's the 3rd meeting, but one of many meetings that will be held at metropolitan sites over the next 3 weeks. So we're building up the campaign in support of the 4% and 5% wage increases. Now I think it's important that we do note that the negotiating environment that we are in is very tough. You can see around the country, other state public sector employees in New South Wales, Victoria and Queensland have been faced with very conservative governments. They've seen job cuts, conditions cut, and they've seen wages outcomes, in fact, legislated by those governments to, in fact, cap them at 2.5% or less in some cases. Our government hasn't legislated, but they have introduced a policy which will see your wages capped if it's successful. We will see the state budget next week and the federal budget the week after. That will undoubtedly see more cuts forecast in health, education and other essential services, and a federal budget which is likely to see significant changes to higher end tax brackets and other issues that will impact on working people. So we don't operate in a vacuum, and by not operating in a vacuum, we know what others within the health system and the public sector have received in terms of wage increases. I probably don't need to remind you that it was about this time, or a little earlier, last year that the nurses were awarded by a government in caretaker mode, that is, they were seeking re-election. That government agreed and awarded nurses a 14% wage increase, 4% this year, 5% next year. Doctors at the end of last year have received 11%. They will get 3.75% from this year. Last year they got 3.75%. they'll get 4.25% in 2014. The union itself has been negotiating, or did negotiate, with Serco, the private contractor that the government awarded the contract for provision and management of facility services at Fiona Stanley Hospital. We negotiated with them an agreement that will cover HSUWA covered employees employed by Serco at Fiona Stanley Hospital. And the agreed outcome for that agreement is wages that are currently equivalent to those paid in the public sector, with a 3.75% increase from 1 July this year and 3.5% increase from 1 July 2015. Now, we've seen recently announcements by the government that they have decided to severely contract their agreement with Serco, and a number of the services, particularly those in patient information management, medical records, coding, ward clerks and others, will now be government employees and not Serco employees. So that's a great result. It is a great result, but we're faced with a government that is only prepared to offer 2.5% in wage increases over the next 3 years. Now, from my perspective, I think it's extremely hard to look at that and say, well, that's fair enough, the government's got to cut back. They've awarded, significant increases to nurses, they deserve it. They've awarded significant increases to doctors, they deserve it. They've, in fact, through arbitration, will be paying significantly more to support staff here at Sir Charles Gairdner Hospital, covered by United Voice this year, 4.75%, I think it is. So every other health worker this year will be getting wage increases significantly higher than 2.5%. Do you think that's fair? No. Yeah, it's just not fair. The government has introduced their wages policy. They've sought through legislation still to pass through Parliament to effectively nobble the independent umpire, the WA Industrial Relations Commission, in the event that any claim goes to arbitration. The Commission will be required to give greater weight to the government wages policy. Again, it's just not fair. So we've seen a government wages policy that will restrict wage increases to 2.5%, or the projected rate of CPI over the next 3 years. I was going to run through the policy itself, but I think I've probably dealt with it enough, other than to point out that its effective date was the 1st of November 2013, and conspiracy theorists amongst us, not that I'm one of them, will note, and it was to apply to agreements that expired after 1 November, will note that the doctors' agreement expired on the 31st of October last year, so they weren't caught by the wages policy. Only paying cost of living increases means that the government either doesn't recognise that there's productivity in health, that you are all working longer and harder and working within a system that's dramatically changing and expanding. So they're not recognising that, or they want to take the opportunity to save dollars at your expense and bank it for their budget bottom line. It is possible that the CPI projection may change. It might be a little bit more, or it might be a little bit less. The State Treasury reforecasts that twice a year, once at budget time, so we'll get an indication next week, and their second forecast revision is the mid-year budget review, which takes place in December. We have a document from Treasury that has been prepared for the public service wages negotiations, which details how they calculate that CPI forecast, and they are in fact forecasting that into the future the forecast inflation, if the federal government does what they want to do with the mineral resources tax, the carbon tax and other things, then inflation rate may in fact drop. So I don't think we can rely on changes to the forecast CPI to deliver much more, if anything more, than 2.5%. So how do we get more than 2.5%? I'm sure you're asking. Well, firstly, we need to get a formal offer from the Department of Health. We've put a deadline on getting that offer as the 31st of May this year. If an offer is not received, or it's received and it's not more than 2.5%, which is what our expectation is because health are constrained by government wages policy, then we need to consider what action is required to apply pressure to the government. One of the first things we're doing, and we'll be asking you to do, is that we're setting up an email facility, email the Treasurer button on our website, which will include a form letter which you can simply sign and send off. That should be ready, up and running early next week. Secondly, when your workplace representatives met on the 2nd of April, they did workshop and consider a range of possible lower level industrial actions that members could take. Now we're going to circulate those via email to members and to our workplace reps, and we are asking you between now and the 31st of May to closely consider those lower level industrial action options and decide what you can do in your particular workplace that would have an impact and send a strong message to government that you deserve more than 2.5%. So we want you to be considering that over the coming weeks. Then if there's not an acceptable offer on the 1st of June, then we recommend that members then implement those particular actions, work bans and work to rule that you've considered, and you start implementing those from the 1st of June. Then if an improved offer is not received by the 30th of June 2014, 30th of June 2014 is critical because that is the expiry of the current agreement. Then we will be organising a central mass meeting of members to determine further escalation of industrial action. I've mentioned the 30th of June being critical. What I didn't say about government wages policy is that there is no retrospectivity to be granted. So if we don't have an agreement in place from the 30th of June, then its effective date will be the date that in-principle agreement is reached with the Health Department and the government. So if it's the 10th of July, if it's the 30th of July, then that will be the effective date and there's no retrospectivity. Also, from the time that that in-principle agreement is reached, if you leave your employment, government employment, then you will not be entitled to any back pay either. That is government policy and government decision, and it applies across the whole of the public sector. So we need to put that pressure on now, and we need to make it very clear to the government that we're not prepared to accept the 2.5% pay increase. Today I issued a media release, and there was a little bit of coverage on radio this morning, and it's available around, I think, it's been circulated. But effectively, I've gone on record saying that there's no way members are going to accept 2.5%. So I want to hold you to that, and I've committed to it, and I'm sure you'll get behind that statement as well. So what do we want you to do to support the campaign? What can you do? Well, we want you to commit. So we want you to go away from here today to commit to being part of the campaign and doing at least one of a number of things, and hopefully a lot more than one. So if you have a workplace representative in your area, go and talk to them, share your ideas with them about what sort of industrial action you can take in your immediate workplace. If you don't have a workplace rep, then talk to your colleagues and get someone nominated. It could be you. So, and if you need some help in arranging that, then contact the union office. We have a Facebook page and a Twitter account. Go to Facebook and like us. Go to Twitter if you've got a Twitter account and join up as a follower. Tell us why being treated fairly is important to you. We have a camera crew here today. Some of you have already volunteered and just did some short grabs to camera on why you think you deserve more than 2.5%. We'll be here after the meeting for anyone who's able to do that as well. We've got a photo petition we're starting up with the corflute boards, write a message on there, get a still shot, and we'll start using those and building those up on Facebook as well. Communication's important. Tell us what's going on in your workplace. We need, you basically are the eyes and the ears of the union in the workplace. We need to know what's happening. If there are any particular issues and stories which you think we should be pursuing, then again contact the union office. Check out our website, do that now. Next week you'll have the facility there to be able to send a message to the State Treasurer, Mike Nahan. We'll be printing up badges and stickers, so if you want badges and stickers, let us know. Importantly, go away from here today committed to talk to at least 3 of your colleagues who aren't here about the campaign and why being part of the union is important to you and important to the campaign. Other staff that you work with, other employees, you work in multidisciplinary teams, you support each other. Go and talk to the doctors, the nurses, the cleaners, the caterers, all the other staff that are covered by other industrial agreements. Go and talk to them about the campaign. Get their support for what is a fair claim that you are making for an increase in your wages. Ask them to send an email to Mike Nahan. They can get on the website and send an email just as easy as anyone else. It's not restricted, it's public and it's open. So talk to your colleagues in your departments and discuss what local actions you could take. That's really the most important thing that you need to be doing over the next 3 weeks. So there are 4 resolutions in the box. I'll read through those and I'll ask someone to move and second them. The first confirms and endorses the union's claim of 4% and 5% over 2 years, no trade-offs, and align with this action to enforce permanent employment. Secondly, rejects the arbitrary and unfair state government wages policy of pay increases of no more than 2.5% a year. Third, resolves to take industrial action from 1 June 2014 if an acceptable pay offer is not received from the Department of Health. And fourthly, authorises the Secretary to call further mass meetings and escalate industrial action as required. So there are 4 draft resolutions. Would someone like to move those resolutions? Been moved by Roger Dallas. Is there a seconder? Sarah Silver. Thank you, Sarah. Is there any discussion in relation to those resolutions? Okay, if not, I'm going to put them to a vote in a moment. Are we ready here? I'll ask you to stand up and raise your hands. All those in favour of the resolution? And anyone against? Okay, I'll declare the resolution carried.